is Stella. Stella is a little foster dog, and she's got a home now. So she was spayed, and in spaying what we do is we make incision, and I have videos that show you spaying. We make an incision through the skin and the muscle, and we take out the uterus and ovaries. But sometimes when we do that, they can have swelling. And let's see, let me turn the light on so we can see the swelling. And the swelling occurs over the incision. Now, dogs don't take care of their incisions. They lick them, they chew on them, they run too much, they jump. But on really most dogs, once they're spayed, especially if they're little, they can run around and almost have a normal life, and it won't hurt their incision. But sometimes when dogs are spayed, you're too sweetie, they'll react to the suture and or bleed a little bit and cause a swelling. Remember, most incisions have double rows of sutures. This incision has a row underneath. That's why you don't see any sutures up above. The row underneath keeps the skin together, and also there's a row on the muscle. So if you see swelling on a suture line, it can just mean a reaction to sutures, or little Stella could have bumped her incision and it's bleeding a little bit.
The most dangerous cause of a swelling where an incision was used to spay a dog would be that the muscle is opened up and allowed the contents of the stomach, or the abdomen as we call it, to go into under the skin. So always, if it just doesn't go away or you're worried about it, please have your vet check it out.
What we usually do when this occurs is we will see what's in there, see if it's just fluid. So I'm going to put a little alcohol on Stella's little belly, like that. Clean it all up. Now you'll notice it's not red, there's no discharges. So what I'm going to do is I wiped it off with a little alcohol, and we're going to see what kind of fluid's in that little. See how that's swollen like that? We're going to see what kind of fluid's in that little. Oh, she doesn't like it either, and I don't blame her. I wouldn't like it either. So you can see I'm drawing it out, and it's just a clear fluid. So we're going to draw that out, and we're going to put that there, and that's one complication we can have during spay. Now, I didn't do this spay, and it doesn't. I'm not trying to not take blame for it, but it's a common occurrence. So we can see that this fluid. Let's see if I can turn the light on it. This fluid is kind of a clear. See the bubble? It's like a little level. That would be level. That right there. This serum is just a kind of a reddish color, but it's clear. Pus would be very much opaque. You can't see through it at all. Not that you can see through this very well, but this is mostly red blood cells. So, and then we can see this is really flattened out, hasn't it? Look at that. Now what I'm doing is checking to make sure the surgery line is still good, which it is. There's no holes in it like a hernia. So, and if you squeeze, you can see right there where the serum's leaking out. So this is called a seroma. Seroma is either a reaction to the sutures, or as they run around, they tear the incision inside a little bit, or stretch it, and it oozes a bloody fluid. So that can happen. Now, you shouldn't do this at home. Do not stick a needle and try to pull out a fluid. However, let me tell you, now that I've pulled this fluid out, it will just come back, because this does not cure the problem. And if it comes back, it will take couple weeks to go away. We can get up now. We're tired of being down like that. So it takes a couple weeks to heal up and for the fluid to be resorbed. So if your animal has a little seroma, then that means within a few weeks it may just get better on its own. Or Whoa, no, what happened? Did that hurt a little bit? All of a sudden, Stella just kind of jumped up, like, okay, I'm done, I'm ready, I don't want to be stuck anymore. So, where was I? Anyway, if the seroma happens on any type incision that your dog may have had, sometimes you can just wait a few weeks and it'll go away on its own. Or you can have your veterinarian draw out the fluid and play with the bubble.
A incision that's swollen can be serious or not, depending on how it looks and how the pet feels. If it's a little swollen, it could be just simply a reaction to the sutures, because remember they're foreign objects and sometimes they cause a reaction and they cause that reddish fluid that you saw. It can be also due to the patient running around and stretching that or irritating that healing tissue. It could be pulling at the scar tissue a little bit and cause it to ooze. And it can be, if it's not red or not painful, it also can be to that muscle layer underneath opening up and letting out some of the abdominal fluid or even a piece of intestine in there. But that's pretty rare because veterinarians are very good at doing neutering. We do them all the time. Anyway, so if there's redness, any oozing, you should probably get it checked out because what we usually do in that case is we use antibiotics to make sure that it doesn't get infected. Sometimes we'll go ahead and put a bandage around the stomach, or we call the belly or the abdomen, in order to keep the patient from licking it. And we also always advise you to get a cone for those animals that just won't leave their incisions alone. I'd say that in veterinary medicine, most veterinarians will tell you that most problems with incisions don't occur from the inside, but they occur from the dog licking on the outside. Anyway, I just thought I'd let you know about that, and like I told you in the video, or when I put a text on there, that fluid obviously wasn't clear. It was a reddish fluid, reddish clear fluid, had blood cells, and it wasn't a pussy, opaque, disgusting fluid. And that's what I meant by that. Anyway, check out my website, Dog Dish Diet. There have free download of Dr. Greg's 11 Practical Home Remedies if you don't have it yet. It talks about bee stings and lameness and washing ears, all the stuff you have at home. Because you know what, those emergencies never happen at a good time. Your veterinarian might be closed. It's a temporary fix for the problem so that you can get by the next day when your veterinarian's open, because the emergency clinics are always wonderful. The staff's well trained, but some people just can't afford them. Anyway, we'll have a great day.